Welcome to the Choose Hard podcast. In today's episode, I have Dr. Grant Elliott, who blew my mind when it comes to back pain. And I know he's going to blow yours too. I am so excited about this podcast because there are so many people who suffer and struggle with low back pain, me included. And I've dealt with this on and off. And this came at the perfect timing for me because we dove into some hot topics that are fresh in my mind. And after coaching thousands of people over the last 15 years, I've had so many questions, so many concerns, and so many clients struggling with injuries that go beyond my scope of practice. But Grant is the exact person to help that because he is not your typical chiro that you just go and get adjusted by. He is an online chiro who is helping people around the world. In fact, he has the #1 online rehab program in the world, literally. And today you are going to find out exactly why, because Grant is going to teach you everything you need to know about low back pain and how to address your back pain personally and practically in your life to get out of pain, avoid surgery, and start lifting like you normally do. So without any further ado, let's talk to the one and only Dr. Grant Elliott.
The greatest things in life all start with a challenge.
You must accept that everything is hard before it gets easy.
Everything you want in life begins with a hard path.
All right, Dr. Grant Elliott, I'm excited to have you on, man. We have not had a back specialist on the podcast like yourself, and especially not one who is doing such amazing work with so many people around the country and the world. I'm really excited to pick your brain, partially because I'm going through back pain right now, so I think this is going to be very applicable. I've been a trainer for 15 years. I've ran this coaching business for almost 8. We'll go into 8 years next month, and the amount of times I've talked to people about back pain is, I can't even count. It's endless, right? And most of the time I'm referring out. But I do think there's so many different reasons people get back pain. There's so many different types of back pain. There's so many limitations that are varying, and it can be such a confusing and complex topic, and it can be very scary for some people. And based on what I've kind of read up on your content, it doesn't have to be so scary half the time. So I'm excited to talk to you and really provide that value for our listeners. But before we get into these questions, can you just give us in a nutshell, who is Grant Elliott?
Oh man. I'm a hardworking guy from the Midwest, grew up in Indiana, knew wrestling and mowing lawns. That's my background. Knew I wanted to go into healthcare at a relatively early age. Hurt my own back cycling. I was a competitive cyclist and I was getting scholarship opportunities, started getting back pain myself, found myself seeing what I know now is a traditional old school chiropractor. Hey, your spine's crooked on this x-ray. We need to see you 3 times a week forever, and I'm going to provide you no rehabilitative care at all. Okay, well, nothing changed in my situation, so I quit racing, and I was like, I don't know what to do. Got into the gym, met a different chiropractor who was movement-based, rehab-focused. I saw a completely different approach to healthcare, and I was like, all right, that's what I need to do. I need to become one of the good guys so I can help prevent my story from happening again. So I became a chiropractor, just 100% focused on movement and rehabilitation. Began building a social media halfway through school. I was like, I got to do something on social media when I graduate and create a business. Well, actually, at the time, I didn't think I was going to open a business. That's a different story. But I was like, I got to post something. And then I became in love with the growth of media. I didn't think there was any way for me to turn it into a business or to do anything, but I just like growing. I like growth to any capacity. So started posting once a week, started posting twice a week. And then I listened to a podcast and I was like, if you want to grow your social media, post every day. And I went, all right, I'll post every day. So I did that for a year, gained 100,000 followers before I graduated. And then that launched me my first year to eventually building the #1 online low back specific rehab program in the world, as it stands at least at this moment, and helped me build a team and help people all over the world, which is incredibly satisfying. Every week we have calls in New Zealand, Australia, Saudi Arabia, Taiwan, all over. We're getting on calls with people and helping people where they can't find solutions in their area because they're limited, but they have the ability to get the right information anywhere in the world. And it's my passion to do this. It's my passion to practice what I preach. I'm highly into fitness and nutrition, and I've been bodybuilding since I was 16 years old. I was grilling chicken at night, bringing in Tupperware as a high schooler. Everyone looking at me weird, but me looking different than everybody else.
Yeah.
So, who was weird. And yeah, I guess that's a blitz of who I am.
I love it, man. It speaks to myself and a lot of the listeners because I don't care what anybody says. There's something about practicing what you preach and looking the part. And I've said this countless times as a coach. It's like if you're a trainer, you need to look like a trainer. But that's not typically the case with chiropractors because nobody ever calls them out and says that. But as somebody who primarily only goes to PT or chiropractors to help me continue lifting, because that's the only real reason outside of like I've had knee surgery back in the day, of course, for rehab purposes. But otherwise, I want to just optimize my body and keep lifting. So being able to do that with a chiro that's also jacked and performs well in the gym, it's a no-brainer,
Yeah, 100%. Majority of healthcare providers don't look the best. Now, generally speaking, you will find usually more chiros and PTs that are more health focused, more movement focused. You're going to get more of those in that area, but that doesn't mean they're really focused on the same goals. And now here's where I'll bring in a relationship where I'll say, hey, really, who should you be seeing for these types of issues, for back issues, for movement issues, for those of you who are focused on the gym, who want to be able to stay in the gym and perform? Here's an analogy I provide. If I had an eye problem, I would not go to a dentist. They work with teeth. I got an eye issue. Okay, now, if you have a movement problem, if you have a lifting problem, you have pain with lifting, pain with movement, then you need to see someone who understands movement, who understands lifting, who understands mechanics. So if you are seeing any provider, general provider, chiro, PT, and they don't lift themselves, they don't understand mechanics, they don't know lifting, they don't know movement, and that's the equivalent of going to a dentist with an eye issue. You got to see someone who actually is doing the thing that you want to do, knows how to do the thing that you want to do. That's what makes a good coach in any particular scenario. So the joke I make is, does your doctor even lift? If the answer is no, but your goal is lifting, I'd probably seeing the wrong person.
Yeah, 100%, man. So what made you so passionate about, because as I was reading up on you, I see a lot about preventing surgery, which I think is an amazing thing, obviously. But what made you so passionate about that? Was there an aha moment? Did somebody you saw tell you needed to have surgery and then you didn't end up having surgery yourself? Or was there a certain client that you can remember that you helped avoid surgery and then it was like an aha moment? Because I think that, especially in the context of thinking about the chiro or the PT or the physical therapist, the people that look the part, they do the thing, and they want to help you keep doing the thing, versus the surgeon or the doctor who doesn't do the thing and goes to the fast, quick, easy, maybe, I don't know the semantics of this, but moneymaker for them or whatever. They go right to the surgery route because that's what they can control. It's what they can do. That's what they can sign you up for, rather than referring you out to somebody like yourself, which is why content is such a beautiful thing, because you're able to get out there so people can find you on their own, because that's probably the only way they're going to find this right path. But long-winded way of me asking, just really like, what made you so into trying to avoid surgery for people?
Yeah, so there's going to be some personal stories that go along with it, which I'll share right now, but also there's just the pure conviction in the right way to do something. So it's the same reason why you would be so convicted in getting anyone to get off the couch and move and to be healthier, because you know what that will do for their career, for their family, for their confidence. It bleeds into so many other things. So you are so convicted in the right approach to life within that context. Same thing here. The reality is that so many surgeries can be avoided. They are overperformed in the masses. And to give you actual hard data, there's a massive study done in 2020. 280,000 people, so not a low sample size, 280,000 people with lumbar disc herniations. Guess what percentage were able to recover without surgery?
I'm not going to guess because I know. I think I read it from your thing.
97%.
Wild.
97%. But guess what? The number one reason for people undergoing low back surgery is disc herniations. It's completely flipped. It is completely flipped, Cody. And so that's what drives me nuts, is there's this thing that is 97% of the time, not my opinion, this is science, okay? 97% of the time can be avoided. But easily 80+% of people who have a disc herniation that have pain that go to see a common, because there are good individuals in every industry, the common ortho, the common neuro, they're being pushed to surgery. And it's avoidable. It increases complications. The more surgeries you have, the higher the likelihood you have of chronic pain, of complications that will not go away for many different reasons. That's a larger rabbit hole that we might find ourselves in. And so what I know is I know the data. I know what can happen when people get pushed down the wrong paths from the jump, because their first piece of information usually dictates where they end up. And that's the scary part. If their first message is fear, oh my gosh, you hurt your back, that's not recoverable. Oh my gosh, it's a disc. Oh my gosh, you need surgery. Versus, hey, you hurt your back? Well, you know what? 80% of the world will experience low back pain at some point. It's normal and it's highly recoverable. You're going to be okay. Hey, your imaging, you know what? Totally expected findings. Nothing to be afraid of. Your situation is highly recoverable. Here's what we're going to do XYZ to get you back. Completely different direction. So one is, I know the reality and I know what people can do and I know what people can avoid. And I want to help people avoid that, because it's a travesty just seeing people push the wrong direction over and over and over. It'd be like for you, if you're like, hey, there's this crazy concept that you can lose weight by eating less. But then 80% of people who are overweight are getting, bypass surgery, like, whatever, like whatever the new thing is these days. Like it would make your skin crawl. Mm-hmm. And that's what it does to me. Now, in addition, earlier on in my career, there's a few key stories, and I'll just provide one. His name's Arminio. He's amazing. He's in South Florida. He sent his wife to us just a bit ago. He was one of my first clients. And I met with him over Zoom, and I took him through an assessment. He had sciatica radiating down to his foot. His leg was on fire. He's in the military. He'd been going through the VA for the last 6 to 9 months. He had seen 2 chiros, 2 PTs in there, done an injection, was going to get an ablation, and he was scheduled for surgery on his hip. Well, wait. Everything I just said was low back related. Why was he scheduled for surgery on his hip? It's because he was in the traditional biomedical model. He had pain radiating through his hip. So from his glute down his leg, they did, you have pain on your hip. Let's just take an image so it can tell us what the problem is, which is not an appropriate way to manage these cases. So they did a hip MRI. They saw a torn labrum. Oh, that's the reason for your pain. Oh my gosh. Yeah. So the low back pain, the nerve pain radiating down to the foot, that's a labrum. Okay. That's a joke. So they had him scheduled for a labrum surgery 2 weeks after I met with him. And so on the call, I was like, do you think this is your hip? He was like, I don't know. I mean, the pain's shooting down my foot. I was like, yeah, well, you know what nerve goes all the way down to your foot? Your sciatic nerve. And your leg feels like fire. Labrum doesn't cause fire pain. Nerve does. We achieved 30% improvement in the one call. Within 2 weeks, his pain was reduced 40% on average. He canceled the labrum surgery because that was an inappropriate surgery. That would have been a surgery on an area that was not causing his pain. So he would have had the surgery, he would have woken up, and he would have felt 100% the exact same, because that wasn't the problem.
Yeah.
So we go through this process. He gets 100% pain-free within 6 months. And he goes, yeah, Grant, not only did you help me avoid a surgery that would have done nothing. It was a completely inappropriate surgery because he was incorrectly diagnosed. But then I helped him avoid a second surgery, which would have been on the lower back. And I helped him get back to competing in CrossFit, which he's been doing so for the last 5 years without a single issue.
And if you can do that, I mean, you have to be out of back pain, because that is no joke. And it's a very ballistic movement. There's no, all right, control, slow, grab the bar, get in a good position. It's like you're timed, you're going, so that's, man, that's impressive. I have a couple questions that I think are going to provide a lot of context to really kind of hammer this point home for people, hopefully, and myself, because I'm curious about these. But I also want to ask this because I'm not sure about this, and I don't want to say this and it be taken by any listeners the wrong way, because I don't know this to be fact about doctors. But you're talking about this 97% study. And things like that are what allow me to, as your point, be convicted of something. Even the different types of surgery. There's studies that show a correlation of increased likelihood of suicide when people have these weight loss surgeries, because they're removing their vice, which is not a good thing, but they have this tool they use to deal with emotions. Food. That's why they're overweight. And when they shrink their stomach with a band, guess what? They can't turn to the one thing that they think helps their emotions. They don't know how to deal and cope with those emotions. That's a bad thing, right? But when I learned that, it made me so much more passionate about doing this the right way, which is probably exactly why you're so passionate about why you do things the way you do. And so my question is, do doctors have to, once they get to a certain point, and maybe you know this, maybe you don't, but I'm curious, do they have any type of regulations around continuing their education, or once they get to their degree, whenever that is, are they good? Because I'm just thinking if somebody graduated 20 years ago from college and they no longer have to continue their education, how many studies have came out since then that could change the way they think and operate? And does that lead to any of these issues we see today?
Yeah. So CEs or CEUs, sorry, are required in any profession, any doctorate level. You have to get a certain number of CEUs every period, and the periods can be different based on the profession. So on paper, the answer would be, yeah, we need to stay up to date. But the problem is, tell me how many of these programs and courses that provide continuing education are of significant value. Well, unfortunately, the people who are providing significant value and really good courses, they're not providing courses that are going to be mandated and controlled by the governing bodies. It's the same thing as saying, hey, the best doctors, they're not going to work with insurance. It's the same thing. So the courses that are provided, I mean, sometimes these can be as simple as just little basic online courses where you need to watch a couple hours of videos. And it's well known that people will just click the play button, go work for a couple hours, come back, and then Google the answers to the questions because they didn't want to watch the video, and then they get their CEs. That's a common approach. So what will determine if someone maintains the ability to be the best provider they can be is not keeping up with their continuing education. It's their own independence and drive to actually be good. And that also includes a provider's first year. Like when I was in school, all of my education came from things I did outside of the classroom. All of it. My very first trimester, I think I did 3 additional seminars. Each seminar is usually around $300 to $500. So, most people you think are right out of college, they're broke, they have no money. I had no problem spending extra 15 grand my very first trimester. And everyone was like, sorry, not 15 grand, 1,500. That's what I pay now to get better. Yeah. They're like, well, why are you spending money on courses? Like you're a first year student. Like you don't know anything yet. And my mentality from the very beginning was like, because I want to be the best. Like, I'm going to learn now. Like, what are you waiting for? And so all the additional courses and shadowing opportunities and traveling to learn from people who I knew were the best, like that's what I use. I don't use anything that school taught me, like at all. So if you have that mentality, then as you're out in practice, you're not going to be learning anything from the CEs. In fact, you should learn very little from the Cs. You should be keeping up to date with the current evidence, current research. You should have a group of individuals who want to be the best and grow together. That should be the environment. But the reality is within any industry, this could be real estate agents, this could be barbers, whatever. I mean, that's like 1% of people.
Yeah. Yeah. It's for everybody listening who is in this industry or any other, it's such good advice because that makes me think back to when I was in school. I interned at a hospital in the gym, and then I interned at a strength and conditioning facility, and then I worked for free for him. And then once I got a job, I got a credit card so that I could pay to travel with him to seminars and go learn. And it put me in debt at first, but I was like, I don't have money, so I'm going to do whatever I can because I learned so much of what I know today from being around really, really good, well-known coaches and traveling and experiencing different gym cultures and stuff like that. Not that I didn't learn anything in school, but to your point, that's where so much of it came from. So that's golden advice. I want to circle back to this percentage because I still have a couple questions on that too. You kind of alluded to some of these answers with that. I can't remember his name, but your example client, just how long it took him. But my 2 questions around this is, number one, are disc herniations, is that the most common back injury you think that you see or that is out there, or just the most common that people get surgery from? And then what's the length that you see on average? Because obviously it's going to vary or rehab, just to paint the picture, because we know how you got to schedule surgery and then you got to do nothing until surgery. And then once you do surgery, you got to recover and then you got to rehab. So I just want people to be able to compare, okay, going this route instead of surgery takes X amount of time. Going the surgery route takes X amount of time. And I got to imagine it's probably not much different. If anything, it's faster to go the non-surgical route, I would assume.
Yeah, typically it is. So to pull that apart, your primary question is timeline, or was there an additional question prior to that? I thought you had two.
I would say timeline, but then also, is this the most common injury that you see?
Yeah, that's right. So, okay, here's the best breakdown for listeners to understand. This is really, really important. Let's look at 100% of low back issues. Okay, we're looking at 100% right now. 90% of all low back pain is in the category of non-specific low back pain. What does that mean? It means it can't be traced back to one singular source, because there will be primary components of that pain. And I'll get into this just a moment. But 90% of low back pain cannot be traced to one singular reason or one singular cause for low back pain. And it's typically a combination of disc pain, muscle pain, and joint pain with influences from the biopsychosocial model. Influences of beliefs with pain, past pain experience, education, even socioeconomic status, nutrition, lifestyle, mental state, emotional stress, work stress. All of these things play a part in someone's pain experience. And the pain experience is very, very important. So one part of your pain is a biological component. There's a tissue that is harmed. There is a nerve being compressed. That's a biological component. But to help paint this picture, someone herniating a disc on their best day in the world, it's not going to cause that much pain. Someone herniating a disc on their worst day ever, that's going to cause a lot. So these experiences drastically influence this. So 90% of low back pain, non-specific low back pain. And non-specific low back pain can recover vast majority of the time, we know 97% of the time, without drugs, injections, surgery. The other 10% are going to be specific instances. So what would be specific? This could be like a common one. We just had this the other day, kidney referral. So, hey, that is a specific cause. Specific cause. This individual actually had kidney cancer referring to their lower back. We were part of the diagnostic process. So that's a specific cause. So what I'm saying is 90% of the time, you guys are going to be fine. That's what that means. 90% of the time, you guys are going to be okay. Disc herniation specifically, easily one of the most common reasons for eliciting pain. But at the same time, I would be remiss to not include this. Just because a disc herniation or bulge might be evident on an image does not automatically mean that's the thing that can be causing the pain. And that's why we include the psychosocial component to it. So I'm going to get back to the timelines here, but this stuff is important.
Yeah.
So an example is low back flare-ups throughout the human experience. Once again, is common and it is avoidable to some circumstances, but it's common and normal. Just because you have some back pain doesn't mean you're broken. Doesn't mean you automatically damaged something. There are many influences. And one that we trace back to a lot in certain circumstances is, let's say there's a particular week where someone's way more stressed with work. Therefore, they're eating worse. They're getting worse sleep. And so stress and anxiety, sleep, all these things are trashed. And then let's say they're passionate about the gym and they're like, okay, I'm going to go crush the gym now to, release all this.
Yeah.
Which trust me, I'm on that same wavelength. Okay. I want to deadlift myself into the dirt. Like, I get that. But in that scenario, your capacity is very low. So then you overload your load management. You overloaded your load management. So in that scenario, all you need to do is de-stress, increase sleep, improve nutrition, and deload. That's all you need to do, and you'll be fine. But in that scenario, what will happen is people will experience a flare-up, a common flare-up, a non-threatening flare-up. They'll go to a general provider that doesn't understand all of these things I'm talking about, or a chiro PT that doesn't understand all of these things I'm talking about. The first step is a 2-minute conversation. Then, let's go write you an imaging script. So then they go and get an image, and then it comes back with disc bulge or disc herniation. So then they blame that evidence on their experience of pain, when in reality, that wasn't what caused their pain. that disc bulge or herniation could have been there the last multiple years and never caused a single problem, because the evidence also shows that 50% of individuals who don't have any pain have a disc bulge on imaging. 50%.
That's wild.
So this is why we need appropriate management, because in that scenario, if I talk to that person, hey, I just hurt my back. Okay, what's going on in your life? Tell me what's going on. History taking and analysis should take time. Should not be a 2, 5, 10-minute conversation. It needs to be in depth. In that scenario, I go, hey, listen, here's what you did. Here's the scenario. You're going to be okay. Deload, get back to me in a week. Like, no big deal. But if they see the wrong individual, MRI, herniation, surgery, oh my gosh, and all this fear unravels. And that's how people get sucked into the wrong path of care every single day. So I needed to include those things when explaining the spectrum of what causes back pain, what's the most common in the origin of this. Now, when it comes to timeline, okay, Grant, sweet, I'm listening to this podcast, I'm feeling more confident, you're making me, feel less fragile, fantastic. What's the timeline? So once again, going back to evidence here, and then I'll use our personal program in stats. The evidence is very encouraging that even individuals that don't seek conservative care, that don't get rehab, if they let the body do its thing, vast majority of individuals with disc herniations can still recover within 9 to 12 months. Now, that's a slow timeline. Some people hear that and they're like, oh my gosh, man, like I can barely move, bro. Like I'm crawling to the bathroom. You're telling me 9 to 12 months. Like, I don't know, like that's making me want to jump to surgery. And I would understand in that context, but that's with doing nothing. That's not taking action. That's not taking accountability. That's not having a good mindset. That's just living. Like you have still really high chances of fully recovering within 9 to 12 months. Now, what does it change to if you do something, if you take action for it? Here's what we've seen. And this isn't my claim. No one join our program and say that this is my claim, okay? We have helped individuals with disc herniations, with sciatica radiating all the way down to their foot. In some circumstances, we've helped people get 100% pain-free within 15 days. Wow. That has only happened a few times. That's why it's an extreme example, but I'm providing an extreme example so I can give you both sides. So yeah, some scenarios completely pain-free within, literally 2 to 3 weeks. That's not common. What is common is helping people get completely, if not mostly, pain-free within 3 months. That is very common. Within 3 months, majority of your function is returned, majority of your pain is gone. Typically by 6 months, and that's the duration of our program, the first 3 months focuses on what's causing the pain, the disc, the nerve, the joint, whatever it might be. So first 3 months gets them pain-free. The second 3 months, we focus on bulletproofing. So we're getting them back into the gym. So before our program is over, our clients are squatting, they're deadlifting, they're lunging, they're doing force absorption movements, like they're moving athletically again. We're getting them all to these things. So by 6 months, they're usually pain-free, strong, confident in the gym again. No, we compare that to surgery. Okay, here's the opposite, right? So if I am of the belief that I can't recover, I don't take action. Okay, well, I'm not changing until my surgery date. Then I get the surgery. Usually individuals cannot start rehab for 8 weeks. That's usually what they're told, 8 to 10 weeks post-surgery. So 2 months of sitting around, usually on pain medication to some capacity. Then you begin the rebuild process. So then you need like another 3 to 6 months after that of rebuilding, if you even have a good plan. If you have a good plan. So that timeline isn't great, and you still have to do rehab anyway. So why not just try to do it in the first place to avoid the situation entirely?
Yeah. I was going to say, as somebody who's had knee surgery, not back surgery, knee surgery twice, even that on a meniscus, that took me longer, at the time. I mean, the last one was in 2019. So things have improved, obviously, but I don't, for me personally, I would much rather avoid at all costs. I think most people are in that situation, and 3 to 6 months sounds amazing, to be honest with you. I don't think that sounds wild at all. I'm curious, there's obviously a lot of different reasons why somebody can start having back pain, and the it depends answer could lead into 3 hours of podcasting, obviously. But when we're trying to boil it down, I'm just thinking like, okay, let's say this person they're on top of the most of those factors. I would say stress is one of those ones that everybody can say, oh, I'm good. Probably not. Or it goes up and down. There's always kind of stress. And there's even people who can handle stress well, but according to research, sometimes there's things that happen internally that it doesn't matter if you perceive the stress as something you can deal with, it can still negatively impact you. So when we consider the movement aspect that could be causing some back pain, in the past, I've heard many people speak on this, and there's a lot of differing opinions. And I've also heard, and you can correct me if this is completely off, but I've heard people talk about almost like a movement dysfunction or intolerance, whether that's rotation or flexion or extension, and maybe that's where it's stemming from. But I'm curious what people can really try to, like, after listening to this, go, okay, let me test a few of these things. Am I incapable of doing something from a movement perspective that could be causing some of the pain that I experience or these flare-ups that happen?
Yeah, for sure. So we're going to focus now in this conversation purely on movements. What are movements that can be causing your pain? What are movements that can reduce your pain? You're absolutely correct. The stress, mindset, psychosocial components, that's huge and very important. But yeah, that could be a 10-hour podcast. Absolutely. So within the spectrum, if you talk to thousands and thousands and thousands of people with low back pain like we have, the most common symptoms individuals will deal with will be increased pain sitting long periods, increased pain bending forward. This could be bending forward to pick something off the ground, or bending over to do dishes or laundry, bending motions, brushing teeth. That's actually a common one too. Bending over to put socks and shoes on. Yep. And then also, if you have been sitting for a long time and you're like, oh man, like I'm really starting to feel tight, you go to stand up. You look 80 years old standing up. It takes you a few seconds to get up straight. It's like a rusty hinge. Yeah. So what is this describing? This is the most common spectrum, and this is a flexion intolerant condition. Flexion intolerant. What does that mean? Flexion is bending forward. Flexion of the spine, rounding forward. Intolerant, pretty self-explanatory. Does not like it. So this classification will be exacerbated by more flexion. So essentially what your body is telling you is, hey, we're getting too much of this direction, too much of this stress. Okay, so if there is someone who's flexion intolerant, what should they not be doing? They should be reducing their sitting. They should be reducing their bending motions. They should not be doing a bunch of crunches, a bunch of leg raises, a bunch of toes to bar, a bunch of hamstring stretches to try to loosen up those hamstrings to take pressure off the back. That's a myth. These are all flexion-based movements that are giving your back more of what it doesn't like. It's more of what it doesn't like, and you're going to keep yourself stuck. And a lot of people find themselves in this situation. My PT told me to stretch my hamstrings, and I'm still in pain 6 months later. Whoa, it's a shocker. So what should we do then? Simple concept of do the opposite. Whatever your spine is getting the most of, do the opposite. And this can apply to your neck. This can apply to your shoulders. This can apply to your hips. Think about the position that your body, your muscles, and your joints are in the most, and think, how can I counterbalance the position my body's in the most? And you do the opposite. So I'm going to relate it to the low back in just a moment. But most of us are forward. So our arms are forward. Our shoulders are in flexion. So they're in front of us, typing on computers, doing things that involve reaching forward. What I would do for the shoulder is just imagine I make my arm straight and I just pull my arm straight back into extension. This is not a motion we're getting throughout the day on our shoulders. And guess what can actually recover a ton of shoulder issues? End range loading into extension. Like sometimes it's that easy. So now for the back, all right, like, hey, Grant, like my job requires sitting. Like I got to sit in the car. Like, I got to sit in these moments. I understand. Take breaks and do the opposite, which would be extension. So what are some simple extension movements that you can begin implementing today? Lay on the floor. That takes gravity off of your spine, laying flat, gravity off your spine. Put your hands under your chest like you're going to do a push-up, and push your chest up off the ground while keeping your hips on the floor. This is going to resemble a classic cobra pose, like in yoga, where you're beginning to restore that extension. Don't hold it. You will be told that by yoga instructors. You will be told that from providers who don't understand disc mechanics. Don't hold it. Do it repetitively. Up, down, up, down, up, down, slowly working further over time, because joints and discs like repetitive load, not static load. They like repetitive load because Our body loves movement. So that's how you can begin restoring extension. Hey, I'm still stuck in my chair for 8 hours a day. That's okay. I don't care about the position you need to be in. I care about the number of breaks you take getting out of it. So even if once an hour, if you can hop on the floor, bust out 5 of those, the difference that that can make in your life is immense, is absolutely immense. So if you feel some of the symptoms I described earlier, you need to be doing extension-based movements because it will reverse the stress. Once again, my body's getting too much this direction. Let's do the opposite to bring it back to the middle, to reverse that stress.
And I think we can apply it to each area. Obviously, if you're getting too much extension, maybe try flexion. I would say most people probably aren't getting too much extension. I can't imagine nowadays.
These are going to be unique scenarios. So there are scenarios that do exist. One is like painters. We do get some painters who are painting a bunch of ceilings, painting a bunch of walls, and they're standing slightly leaning back a majority of the day. So you're right. If through movement testing, now we're painting with some broad strokes here, not too broad, but if through movement testing, we can clearly see, yeah, this person's extension intolerant. When we test flexion, their symptoms improve. Okay, you need flexion. We would then implement the opposite. Hey, lay on your back, bring your knees to your chest, rock them in and out repetitively, loading the lumbar spine into flexion. This presentation can also be more common in individuals who are above the age of 65 when they start to develop something called stenosis. Now, this is also something that's misunderstood. People like to immediately diagnose and label people based on imaging and then form their entire treatment plan based on a picture, which drives me insane. So this does not apply to every scenario. Definitely not every scenario. But more likely, if someone's above the age of 65, they tend to have more extension intolerant scenarios where we would want to implement flexion. These are the typical presentations, yes.
Got it. I'm curious, and by the way, I love that you're able to break this down the way you are and just clearly state over and over again. It's not a one size fits all. I mean, I don't know how much you follow the different, like, just strength. And I love this guy because he's just a legend, but Louis Simmons, I remember when he had a back issue and it was like hyperextensions and he just
reverse hyper.
And then everybody's like, you have to do reverse hypers. And then I remember listening to a Joe Rogan podcast, and Joe Rogan bought a reverse hyper and did it, and it helped his low back. And I was like, oh no, don't say that, because now everybody's going to go get or do reverse hypers, and that can make it way worse if that's not what you need to do. So it's good. And one of the things that I just want to bring up, I think I know the answer to this, but I don't know if the non-trainer or listener might. With regards to rotation intolerance, some people will be like, well, am I intolerant to rotating to the left and I need to rotate to the right? And I would assume it's like, hey, let's do some anti-rotation movements. But I'd also be curious if there's more to it than just that, because even doing an anti-rotation sometimes can cause people to do rotation if they're not strong in that pattern, right? So how are we trying to, obviously not the whole picture, but how are we trying to treat a rotation issue with somebody?
Yeah, sure. Having a presentation where repetitive loading rotation to the opposite way to restore the condition is a rare scenario. So having pain with rotation, not a rare scenario, but rare scenario where, hey, rotating to the left, let's rotate to the right. Most of the time, sensitive discs that are flexion intolerant will be sensitive with rotation. So even if that person is like, hey, you know what? Like, I can bend over decent. Like, I don't feel terrible, sitting long periods. Like, it's really just rotating. Still the first place we would check is for flexion intolerance. So we would still implement an extension-based protocol. Once again, there's many different directions. I'm just keeping it broad. We might still implement an extension-based protocol. Okay, now let's recheck your rotation. And let's just say they do 10, 20, 30 Cobras. And then they recheck rotation and they go, hey, my rotation's like, I can go like 30% further until I feel the pain. Okay, that's not a rotation intolerance. That's still a flexion intolerance. We're removing the movement obstruction and you're restoring the motion that you need. Oh gosh, what was the second component of your question?
Anti-rotation. Is that
Yeah.
useful?
So now in the grand spectrum. Okay, so here's what we would do for that person. Let's say we identify, hey, you have a sensitive disc. Some sensitive discs are sensitive to rotation. Okay, great. We need to load the disc into extension. Let's reverse the disc. Let's get it back where we want it to be. Okay, now before we restore extension movements, Yes, anti-rotation is a phenomenal place to begin prior to then loading the rotation itself. So it's the concept of like, if I'm trying to recover an injury, like do isometrics before like full concentric eccentric. That's like a simple example is, hey, let me just get the muscle used to loading this before I take it through a full range. So the scenario would be, hey, hurts to rotate, sitting long periods hurts, and I got some pain raining down the leg. Okay. I'm making this extremely cookie cutter, everybody. This is not the dynamic of the program, but we might do, all right, let's focus on cobras. Let's focus on other extension-based movements. Great. Symptoms going down. Okay. Now let's focus on just stability of your core in general. Okay. Build stability of your core in general. So this could be belly breathing, diaphragmatic breathing, dead bugs, bracing work, just to learn how to actually create intra-abdominal pressure to stabilize. Because we know eventually we're going to get them into squatting and deadlifting. So we want to root this as their foundation. Okay, great. We have fundamental stability. Now let's implement fundamental stability with anti-rotation. So now it's brace and Palloff press, brace and single arm plank. That's why we don't jump straight to that. We want them to be able to do that movement with proper intra-abdominal pressure so then it relates to their other performance and they can translate it to other activities. So do that first. Okay, great. Palloff, single leg plank, single arm plank, single leg bears, build anti-rotation. Now we ensure that their range of motion is completely pain-free and end range rotation. Okay, great. Now we start loading rotation. So perhaps I'm loading, let's just say 20 pounds to 45 degrees. I do that for a week. Okay, great. Symptoms don't increase. All right, 40 pounds, 45 degrees. 60 pounds, 45 degrees. Okay, now 30 pounds, full rotation. 50 pounds, full rotation. 70 pounds, full rotation. It's just an example of progressively overloading that tissue to then restore both the body's physiological capabilities of that motion, but also the mind and the nervous system's sensitivity to that memorized pattern too. And that would be the approach.
Got it. The nervous system was something I wanted to ask about and kind of touch on as well. When I'm thinking of like flare-ups, for example, even in my own case, I can think of situations where looking back, it's like, I don't even know, like I was trying to do things to fix the issue. And I'm like, did I actually fix the issue or did my nervous system kind of just release tension? I took a break from the gym, deloaded, did what I need to do. And some stuff, yes, like movement and mobility and things might have helped. But I'm curious if the nervous system has anything to do with this tense feeling or this stiffening or this tightening of muscles that might be restricting your movement. Because sometimes when people have a flare up, it's almost like everything is just so tight and then it releases and it's like, okay, but now flexion, extension, whatever the issue is, doesn't hurt at all. I think it's gone. And then all of a sudden it flares up again. Mm-hmm. What role does the nervous system have in this like on off switch of this flare up, if that makes sense?
Yeah, so much. So much. Your nervous system is your pain experience in many aspects. So your nervous system can memorize pain and it can be oversensitized through multiple variables. There's an amazing video for everyone watching YouTube. It's called Tame the Beast. Tame the Beast. It's about I think 5-6 minute educational video. We actually have it plugged in to the first like chapters and first week in our actual program because it's an easy but very digestible and impactful message about how your nervous system sensitivity can become elevated. So here's what can trigger a flare up. Let's say on a given week, Cody, you are sleeping normally, eating normally, work stress is average. Let's say all those things are in control levels, at control. So just for visuals, everyone pretend with me. I'm holding my hand around my shoulders, okay? Let's just say my hands is at my shoulders and the bottom of this well is at my belly button. Let's say this is where your trigger normally is. So a threshold needs to be reached where it hits my hand to elicit the signal of pain, where my brain will create pain. This is where my threshold is. If someone goes on vacation, meditates, does less of the bad movements, more of the good movements, better sleep, this threshold increases. It's harder to trigger the pain because the nervous system is less sensitive. Okay? Now the opposite occurs. Dude, you're losing your job. You're getting divorced. Like you just lost your dog. Like bad things happening. Now that threshold gets lower and lower and lower. So now let's say normally if I were to stub my toe on a table, that would normally not be enough, let's say, to trigger significant pain. But now because my threshold is so low, AKA my nervous system is so sensitive, now that sends me through the roof. And that's going to create a flare-up where under normal circumstances, a flare-up would have not occurred. That's the role your nervous system plays in that pain and the experience that other things in life have on it as it results. So in that scenario, what's really helpful for individuals to hear, and I love talking about these topics, Cody, one of the best things to do is to consider, did you actually do anything to make your pain worse? So there will be scenarios where someone will be in the gym or not even in the gym. You know, we've had individuals who are going to the bathroom and they feel a pop in their low back and then all their pain, significant increases. Okay, that's an acute incident, very obvious where it occurred from. But let's say you're living your life normally, like you don't do anything out of the ordinary, but then all of a sudden all of your pain increases. Don't freak out. Think, okay, I didn't lift any differently. I didn't move any differently. I didn't do anything significantly different in my life. Okay, then what does that mean? It means you didn't injure yourself. That's what that means. You weren't in a car wreck. You didn't have a massive fall. You didn't go try to pull 700. Like, you did not re-injure yourself. So why is your pain currently elevated? It has to be involved with things outside of the biological bubble. It has to be involved with something else. And that should be extremely helpful and extremely encouraging for people, because the number one fear when their pain increases, assuming they didn't do anything to actually do it, sometimes they do. Sometimes people are feeling better and then they're like, I'm going to go do a kickboxing class now. And okay, too much, too low, too fast.
Right.
Okay. Too much low, too fast, I meant. But in this scenario, people will panic and I don't blame them. What's going on? Did I just re-herniate it? Did I tear something in my back? I can barely move. Do I need to run to the ER? What's going on? Like, it can spiral people into a massive panic. But if you calm down and you think, okay, did I actually do anything? And if the answer is no, that's your nervous system. That's the rest of your life that's affecting your nervous system. Let's analyze what else is going on in your life and figure out why the flare-up occurred. And one very brief example, this is normally a longer story, but I'll make it very short. We had a client in Brazil, got her completely pain-free within 8 weeks. Amazing. Pain-free for a month. She was told she needed surgery. Message us, all my pain's back. I did something. I re-injured myself. All of my pain's completely back. Made absolutely no sense. Absolutely no sense. We got on a call with her, and I'm really expediting this story. We get on a call with her. We talk her through this exact same concept. Did you do anything? No, I didn't. No, I didn't. No, I didn't. But I re-injured myself. Hey, we know you didn't because you didn't do anything different. We start picking apart what else is going on in her life. Turns out the day before all of her pain came back, her best friend died. There it is. We helped her realize it. Within 48 hours, 100% of her pain gone again. That was it.
I love that you guys take it to that level. We're really passionate about the psychology behind what we do as well, in a different realm, obviously. And I think our mind, our emotions, our nervous system, it plays such a role in so many factors that get disregarded because it's out of scope of practice, which is just such BS, because we just need to ask questions, build trust, and have a conversation, and it makes such a difference. So I love that. I know we're going to be running up on time here soon. I could ask you a million questions. This is good. I have a couple things I just want to run by you, and then I want to kind of hear just about like exactly how your program works, because it's online. And I know there's a lot of people probably listening who may not have ever even heard of being able to, quote unquote, go to the chiropractor via mobile or remote, right? So I really want to dig into that to finish things up. But before I do, I have a couple questions, and if you think of some myths or things you want to spin off to after these two, that's totally fine. The first one isn't necessarily a myth, and I have no issue with this person. I think that there's got to be a decent amount of value that he's provided in this industry because he's such a well-known name. But Dr. Stuart McGill created the McGill Big Three, and you're not the first person I've talked to that is either a chiro or a physical therapist or just a really high-level strength and conditioning coach, that none of which I've never heard anybody say anything bad about him. but made me feel like the McGill Big Three was just too simple in order to like be the solution. But for people like me, I'm like, but it's helped, not me, but so many people. And I'm like, how can it be that simple? It's 3 movements. They're not that complicated. I don't even see how you progressively overload them, which as you're talking about that factor, I'm like, man, that makes so much sense. Why would we treat it any differently? Do one little thing and then just never progress it? That doesn't make sense, you know? So can you explain why, or if I'm wrong, but if not, why it's not just that simple, or why maybe that has worked for so many people, yet usually maybe there's more to it than just the McGill Big Three?
I have as much time as you have, Cody, just so you know. So here's my response to that. First off, there are stepping stones to research and development. One finding and one level of research will never remain the standard, ever. So one thing I just want to plug into the listeners who hear this is, this is how things used to be described. And we know very, very clearly that this is no longer the case. We know now that the spine is very strong, very resilient. If there's ever an approach that is telling you the opposite, that's telling you to not move your spine, that if you're doing deadlifts, you're not going to be able to play with your kids or your grandkids when you're 70 or 80, that you can't have both. That is not accurate. Your discs can adapt. We know that now. It used to be stated that they can't. They absolutely can. Your discs and joints and connective tissue, these things can adapt. It's okay to round your back. It's totally fine to do that. Sometimes we're flexion intolerant and we need a different approach, but your spine was made to move. It wouldn't have so many joints if it wasn't. Okay. Your spine is not a 2x4. So keep that in mind. Our spine's made to move, and any approach that makes you afraid to move your spine, or virtual surgeries where you pretend like you had surgery, no, that's not cutting it. So now moving on to McGill Big Three. Okay, if it's so simple and you can't progress it, well, how could it help so many people? Amazing question, Cody. And here's why. If I'm someone who's afraid to move, who's afraid to exercise, and I think everything I do is going to hurt me, so I'm stuck in a rest panic state, but then someone of perceived authority, maybe potentially also authority, depends on how you look at things in life, tells me with 100% confidence, hey, here are 3 movements you can do that are safe, that you don't have to worry about. You just gave me a Xanax in an exercise. That's what you did. So now I have the confidence to go do these 3 things, and I don't have fear with these 3 things. So now you're getting someone who is not moving and afraid to move and not be afraid. Well, what do you think is going to produce better clinical outcomes? Moving and not being afraid. So they do these 3 movements and they go, wow, I felt so much better. Okay. Is it because your core was weak and now it's strong? Is it because your spine wasn't stable and now it is? Or is it because you're panicking and not moving, and now you're not panicking and you're moving? Okay, that's typically the scenario. So this is where the myth of core stability, core strength, and back pain really kind of started to begin, truthfully, is people who were deconditioned, weak, not moving and afraid. They do a core exercise. Now they feel better. Oh, it's because my core was weak. Because I did a core exercise, now I feel better. Therefore, it was my core. But if I had that person do cartwheels, they would feel better. Yeah. So it was cartwheels. That was the fix. If you take someone who's afraid, not moving, and deconditioned, and you get them stronger or doing anything, that thing will make them feel better. That's the scenario. Now, there can be some core connection. Yes. There can be some stability connections. Yes. There can be core function components that I mentioned earlier. Breathing, bracing, knowing how to create intra-abdominal pressure. These are things that we do focus on. But understanding the difference between, the reason my back pain hurts is because my core is weak. That's a myth. There's no clear evidence to support that. So that would be my justification behind why some people feel better with McGill Big Three.
That's good. That's I love the emphasis on movement so much. I think that in that analogy, your spine's not a 2x4. That is really good. And it's funny because even I've talked to people, I've never talked to people about that, but I've even talked to people about like ankle issue. And then ice it and then they wrap it up and they got a big brace. And I'm like, you got to get some circulation, some movement. Like, let's not just put a brace on it and restrict its movement. But when it comes to your spine, that's what a lot of people do. It's what you even get stiff. And it can be confusing because, for me, there's more issues with lifting. I'm currently going through some back pain right now. I ran 6 miles this morning. Totally fine. In fact, I feel great running. It makes me want to run more because I'm like, it goes away. And then I can just clear my head, which made me think like, okay, I'm at peace when I'm running. But also I'm definitely, and I kind of already knew this, flexion tolerant. When I run, I'm in extension typically. So it's being able to pick it apart and educate people like this is just so unbelievably helpful. And I think that the practicality of what you're giving as far as advice is so good too, because it's the same thing with yogis or people get really into stretching. And it's like, great, you can touch the floor with your palms and your hamstrings are super flexible. Now do a deadlift. And like as soon as they put a load in that hamstring stretch and a stiff leg deadlift, they're weak. They're unstable. They can't do it. And it's like, well, what's the point of being hyper flexible if you can't load it? Because picking up your grandkids, you bend over or hinge if you're doing it perfectly, which nobody does, and you're picking them up, right? So I love it. And the other myth or thing I wanted to run by you too is, and you kind of alluded to the tight hamstrings thing, which is why I'm bringing it up, is butt wink. What's the deal with butt wink? I haven't heard much about it as of late. Really, it's not something that I've heard talked about, but I remember that in just the strength world as, a decade ago when I was learning things, it was like a very, very big no. You squat, you got butt wink, like we got to fix that issue right away. That's going to lead to back issues. Is butt wink a problem? Is this a myth? Is there something to it? What does this mean?
It's only a problem if it's a problem. That's it.
If there's pain.
Yeah. I mean, look at some of the elite lifters in the Olympics. Watch people in the Olympics. Are they winking? Yeah. A bunch of them are butt winking. Like, do they feel fine? If they give me a thumbs up, I go, okay, I'm not going to touch it. If there's someone else who's super flexion intolerant and they love squatting heavy and they're going ass to grass, and every time they butt wink, they flare up, should we address it? Yeah, probably. Like, that's really it. So it's not a problem unless it's a problem. So the last thing we want to do is arbitrarily paint any type of movement or position as bad under no context. There is no good or bad movement. There's just the movement that your body's not prepared for.
That's good. I like that. Okay. How does your program work? I know you have grown this over time. You started it at a crazy time. I remember COVID as well. I started my online business right before COVID, not knowing COVID was going to hit, ironically, but that was a crazy time. You did it at a perfect time. You did something that nobody had done before, I would assume, because I've never heard of it. And now you are helping people all over the world, very successful, the #1 program. How does this work? Obviously just, give me the pitch in a way. Like, I want to sign up. I want people to hear about this because this is something that is, as an online coach who focuses on mostly body composition. That's what people hire us for, right? Sometimes performance. One of the hardest parts is when somebody needs somebody to specialize in rehab with them, whether it's chiro, PT, anything. I might be across the country. So to cross my fingers and hope that the provider they have near them is going to do the right thing and help them out, and I'm trying to dissect what they're hearing, that's a scary scenario. So for online coaches, you're like the perfect solution to this that we can refer out to. And obviously the proof's in the pudding. You're helping people everywhere. So just give us an overview of how does this actually work? How do you guys see people? What do they go through, and what's the process like?
Yeah, let's make this as digestible as possible. So I'll refer back to fitness-related concepts that will really resonate with your audience. So Cody, for you, you've been lifting forever. Okay, if I were to send you a video of me squatting, full picture, and I were to ask you advice on my squat form or deadlift form, would you be able to watch my movement and provide advice on that?
Yeah.
Yeah, super easy. How many people out there are looking up yoga flows or mobility flows on YouTube and following along? Like most people who care about their health. Right? Yeah. This is very simple concepts. That's because it's movement. And as long as you can see someone's movement, and as long as you can get feedback from them regarding the movement, then we can help anyone. Because low back pain is largely a movement-based problem, and it needs a movement-based solution. So that's exactly how we do it. It isn't complicated. It's complicated if you don't know movement. It's complicated if you don't understand mechanics. It's complicated if you don't pick into these other things. But for us, it's really incredibly easy. So we always start with a free initial consultation with everybody, just a short 15-minute call to listen to your situation to ensure that you're in that 90 to 97% whose conservative care is appropriate and that you shouldn't be referred out for some special test or alternative specialist. We want to make sure that you are dealing with a common thing that we can help. Great. Next up is a 1 hour full evaluation where we take you through movement testing. So various ranges of motion, various orthopedic testing. So special tests that only a doctor can perform. No, you just teach someone else to do it. Hey, bend over, touch your toes, bend back, rotate, perform this nerve test. They can do anything. We can show them anything we would ever need to do. And then they provide us feedback. How does that feel? This one feels fine. How does this feel? This one hurts. Where? Down on my knee. What does it feel like? Burning. Okay, great. Continue to go through the movements to see their movement and understand their triggers and responses to the movement. Then we'll do exercises with them live on the first call. We'll say, hey, based on these triggers, it's clear that you have this intolerance. So now let's test this movement pattern that typically helps these conditions the most. So let's try these exercises together. Maybe it's an initial home run. Maybe we need modifications. Maybe we need to go a different direction. We typically do as much testing as we need to get a positive result. All right, sweet. We're starting to feel better with these. Fantastic. Let's redo your initial movements now. How do they feel now? Oh, this one's better. This one's better. This one's the same. This one's better. Okay, sweet. We're moving in the right direction then. And then that confirms what is causing their pain. It also confirms the direction we need to go to fix it. And then based on that individual's unique circumstances, then we develop a robust program to help guide them one-on-one from beginning to end and ensure they get back to doing all the things they want to do pain-free.
I love it. It makes me think, and it makes so much sense the way you broke that down. Like I watch people's technique and form when they're lifting every single week, and I critique and give feedback and help them. Very similar. But I think the reason it's not a concept that normal people kind of gravitate to is because when we think of chiro, we go, I need to go to chiro and get adjusted. So without opening a can of worms, why is it that chiro means get adjusted? Why is it like that the path? And it's so rare to see people who are chiropractors doing what you're doing, which is very movement focused. You're taking patients through from point A to point B, getting them out of pain, and you're not adjusting them once.
Yeah.
So why is it so polarizing?
Yeah. I would love to see a medical doctor that's been trained in medicine the majority of his life go 100% online with rehab. That'd be great. You know, we have singular connotations with different medical professions, and that's okay. You think medical doctor, medicine, PT, physical therapy, you know, you're going to think rehab exercises, chiropractor, you think adjustment. That's because that's a majority of what that profession is associated with. And that's okay. Majority of people think I'm a physical therapist. I don't care what people think I am. I don't care about is getting results. Yeah. So the reason why a majority of people have this misconception or that they think they need to go is because they think they need to be touched. Someone has to touch me. Someone needs to put hands on me. And trust me, the people who don't like the impact of our program, the people who don't like the fact that we're, you know, helping clients in their city that they're not getting into their office in person, they're the ones who are saying, no one can help you without touching you. Well, let's break this down. You think if someone has a disc herniation, you think you can touch a disc herniation? Are you sinking your hand through 4 inches of muscle into their spine to touch that disc herniation? What are you talking about? No. If it's a movement-based problem, then we need movement solutions to resolve it. And there is no degree of touch if it's a movement problem. Sometimes there's additional things. Sometimes there's tissue dysfunction. Sometimes there's other things. Okay. But if it's mostly a movement-based problem, you need the right movement plan, and you don't got to touch somebody to provide the right movement plan. You just need to have good clinical evaluation, good diagnostic skills, and good movement-based evaluations. That's what will get them better. So can adjustments be helpful because they're moving your spine? Yes, but that's an intervention that only someone else can perform on you. It's designed to temporarily move you, create a window of opportunity to reduce your pain. But that's not changing your long-term mobility. It's not changing your education. It's not changing your lifestyle. It's not giving you the new movements and mechanics and exercises to follow to change it. No, it's a passive therapy. You can't have your chiropractor following around with you 24/7. Second you need pain, boom, it's gone. That's not a realistic lifestyle. So you got to figure out how to fix it yourself. That's what we do.
I love it. That's so good. I mean, I think this is something that probably already is and could very well change the industry for the better, honestly, your industry, because it's crazy how, I mean, I remember people way back in the day saying the same thing with just training to me. Like, how could you train somebody online? And I was like, you can't afford to have me in person with you 5 days a week, and I'm not going to follow you home to the kitchen. So how are you going to get the result you want if I'm not remote and available? And it's like kind of an aha moment eventually to people, now it's a very common thing. So I can only imagine that it's going to happen in your industry as well. And you're kind of leading the front, man. So it's really cool to see.
It is, man. So I went all in on this in 2020, and the first couple years, other chiros and PTs were reaching out to me like, hey, how you doing this? How you doing this? But within these last 2 years, within the last 6 months, the number of people who have reached out to me, the numbers are massively changing. So for anyone out there who might be a fellow provider, the future of physical rehabilitation, which will be the majority of health focus when it comes to musculoskeletal conditions. It should be, and it will be. We're slowly getting away from quickly running to injections and medications and interventions. If you are in the physical rehabilitation realm, I'm going to change your lifestyle, I'm going to change your movements. If you don't have an online component to your business within the next 5 to 10 years, you're going to be extinct. Like the wave is coming right now. I was ahead of the wave. I've been riding it. But it's coming now, and the wave's going to pass probably in 3 to 5 years. The wave's going to be passing. That's an opportunity boat that people need to be jumping on. And yeah, that's what people are going to be looking for, because people want more value, more structure, more guidance, more access. And how do you get that? Through an online approach. That's how you get it. Like the clients who come to us, they've tried all the in-person stuff. Like, Our clients are not people who are like, oh, you're the first person I've tried. No, we are the last resort before surgery. Yep. That's us. Like, people do all the local, cheap, passive stuff first. Like, okay, well, I don't want to get surgery, so I'm going to try Rehab Fix now, see if they can avoid the surgery. And we do majority of the time. We are the last resort. So, like, you got to get on the bandwagon and get individuals and people out there more value, more help, more structure, because the 10 minutes you have with them in the office, or even if you're a rehab provider and you're doing 30, 45 minutes, that's great. That's great. But if the only impact you have is right then and there, you're still losing impact that you could otherwise be providing.
Yeah. Oh, it's so good, man. Extremely informative conversation. I think what you're doing is amazing. I think it's going to really, and as I can see it is, really revolutionize that side of the industry. I'm excited to watch it. I'm going to be reaching out because I'm excited to be a part of it, and because I need help, and it sounds way more applicable to my life and convenient and helpful, to be honest with you. So I'm excited about it. But for everybody listening, I'll put all of your links to find you in the description. But if you can just tell them where to find you, I know you have amazing content on Instagram, so just maybe where to find you, the best places. That would be amazing. So I can put that in the show notes of this podcast.
Our number one source is Instagram. The handle is Rehab Fix. I am Rehab Fix on all platforms. If you don't have Instagram, you watch YouTube. I got our stuff on YouTube as well. And one thing I do want to provide an opportunity to your audience is if you go to our Instagram and you message me just the word podcast, I have a training that I have not put in any ad or any organic platform. It's nowhere. And it's a highly, highly, highly valuable video where if someone messages that, I'll immediately send it to you, where I will actually walk you through our full assessment evaluation to take you through a self-diagnostic process, test to do, if certain movements trigger your pain, what that means and what you can do about it right then and there, so that I can provide you real-time results without me even talking to you. And if that provides you some value and you see the window of opportunity and this podcast and maybe that guide gives you some hope and you want more help, then we're absolutely here to help you achieve that.
I love it. I'm going to put that in there. Make sure you guys go message him, follow him. Unbelievable, man. Thank you so much for spending the time with me and sharing all the wisdom that you have and just answering all my questions. This has been, I knew it was going to be a good podcast, but honestly, it was even better than I expected. So honestly, I really appreciate it. Thank you for spending time with me.
My pleasure, man. I love doing this. And I love people like you who are putting good information out there and who are helping people choose the hard thing and choose the better path of how to optimize their life and live it to the fullest.
That's what it's all about, brother.